This show is for informational purposes only. In view of the complex nature of health and disease, it is only recommended that you change your current treatments or healthcare practice with the direct assistance of a health professional. You can contact Dr. Dale if you desire to achieve true health. Call his office at 931-591-2010.
Hey everybody, thank you for tuning in. It's the Tuesday night episode of The Wild Doc. Sorry I was on vacation. My wife needed my presence with the kids. We had a little fun, got a little sun. That rhymes. But we had a great weekend with my family. And the reality is, countries that allow for people to take time off, to enjoy time with their family, their friends, to relax a little bit, those countries have a lot better outcomes in terms of their health. They actually get to live longer, they get to enjoy life more, they reduce stress more, and we understand that stress causes disease. So we are specifically going to be discussing prostate cancer this evening. And I will do a follow-up as well. So we'll do about 2 weeks of this, hopefully get through a lot of the information. But I do want to share with you right now a book that I would highly recommend every single person, every single male read, unless you're just going to take this video, take the data information, make a decision, and save yourself the time. But this book right here is phenomenal for any man needing to make a decision on whether they would want to get PSA screening. I'm neither here nor there on PSA screening, so that would be prostate-specific antigen testing. Because a test could potentially help, but the problem is the treatments we're utilizing are killing men faster than doing nothing at all. Yeah, you're probably thinking to yourself right now, like, how in the world can this guy say such a thing when I've seen so many, or you're thinking yourself, you've been diagnosed with prostate cancer, you know a family member or friend who has, they've been treated for prostate cancer, doctors said they had to have those treatments or they would die. And the reality is that was a big fat lie. And who says that? None other than Otis Webb Brawley, MD. He is the Chief Medical and Scientific Officer and Executive Vice President of the American Cancer Society. Dr. Brawley currently serves as professor of hematology, oncology, medicine, epidemiology at Emory University. He is also a CNN medical consultant. He is a graduate of Pritzker School of Medicine, University of Chicago. He completed his residency in internal medicine at University Hospital of Cleveland, Case Western Reserve University, and fellowship in medical oncology at National Cancer Institute. Wow. He says, doctors break ranks about being sick in America, how we do harm, specifically talking about how doctors in the cancer industry is literally killing men. And by killing men, they're using literally the statistics by killing men to make people believe that they're actually reducing prostate cancer. Let's read some of the excerpts from this. To understand the magnitude of the societal experiment, the societal experiment is the reality that prostate cancer screening does not save lives, and that the treatment of prostate cancer, cancer or prostate problems with chemo, radiation, and drugs, hormone deprivation, is killing men faster than them doing nothing at all. Now, is there a few men out there that may benefit? When they don't have screening, all of a sudden they start having serious urinary tract blockages, and they have to have a surgery to open that path. Yeah, there's going to be some benefit from medicine and from emergency medical care from that. But the reality is the treatment of the cancers is not benefiting. We're going to talk about, in this segment, hopefully, we're going to get to several things. We're going to talk about how the U.S. Task Force, U.S. Preventive Service Task Force, has issued a warning to the American public saying the screening of PSA, prostate-specific antigen, is driving men into treatments that kill them faster, that harm them more. There's zero benefits, and there's a net harm. We're harming men from many different things. We're going to talk about the harms of both the screening, how that could harm. It's almost a harmless blood test. We're going to talk about how PSA actually is a signal for the body fighting cancer, how high PSA is a good thing, folks, a good thing. So everybody online right now, make sure you're sharing this, because the reality is it's sad, because people think by lowering with androgen deprivation treatment, hormone therapy, by lowering PSA, men think that they're living longer. They think that they're doing something good, but they're actually counteracting the way in which God designed the body to respond to cancers. Something phenomenal. Breast cancer, women have increased or elevated PSA, prostate-specific antigen. Women don't have a prostate, but they have increased PSA, and those women who have increased PSA levels in their bloodstream have a reduction in the body's, have an increase in the body's ability to prevent metastasis, which would be the spread of cancer, because PSA is actually anti-angiogenic and anti-metastatic. Phenomenal. So high PSA is a signal by which the body is a signal, could be a signal, or could be read as a signal, an indicator the body is actually effectively fighting off the spread of cancer. Phenomenal research we got to go through and the public should know about. Prostate test, biggest public health disaster. So I can clear this study from this article from my little notes I've got a review here. Everybody online, share the truth. Don't just like it. Sharing the truth is the only way we save lives. All right, Richard Ablin, University of Arizona. He effectively discovered the PSA test. He says, quote, and this was from 2010, "I never dreamed that my discovery 4 decades ago would lead to such a profit-driven public health disaster." Profit-driven public health disaster. That's what prostate cancer screening has led to. Profit-driven. Again, if we look at the American medical system right now, the disease care system in America is not effectively teaching people how they can get healthy, get well, stay off medications, drugs, not spend an arm and a leg on medical treatments. They're literally, an annual bill for PSA screening is $3 billion that does nothing but drive men into harmful therapies, harmful treatments. And again, I can say this stuff because it's not my opinion. It's in this data, it's in this research. And again, everybody understand that I will post each one of the links to these articles and to these research studies will be on thewilddoc.com with this video when it is posted. PSA test can't detect prostate. What? Oh, they can't, really. I'm just reading random stuff here. Prostate cancer is the second most common cancer in men worldwide after lung cancer, killing about 254,000 men per year. 1 in 6 men in the United States will be diagnosed with cancer at some point in their life. So, it says here, prostate cancer treatments, including surgery, radiation, will cause incontinence, erectile dysfunction in 1/3 of their patients. Many women will experience bowel problems, won't be able to go to the bathroom, or won't be able to hold their bowels. Testing should absolutely not be deployed to screen the entire population of men over the age of 50. The outcome pushed by those who stand to profit. I mean, just sad. It's so sad. You will actually learn in this episode that doctors who wanted to come out and talk about how a treatment, a vaccine they developed, a vaccine to treat prostate cancer, how harmful and it was killing men. How doctors who came out with that evidence and information who were speaking out to try and save the lives like I'm trying to do right here, those men and women, those doctors, those urologists, those cancer doctors, who would stand to profit if they kept their mouth shut, had death threats. Death threats from the pharmaceutical industry and the industry of individuals standing to profit from the continued use of those drugs in that vaccine. So, phenomenal evidence and information here everyone should have in their hands. Otis Webb Brawley, again, the book, How We Do Harm, phenomenal book. To understand the magnitude of the societal experiment, consider another point of information. Deaths from prostate cancer have been dropping every year over the past 2 decades, and this drop has added up to 30% since 1990. Is cause-specific mortality dropping? Cause-specific. See, what many people don't recognize is many of the drugs are not studied if they extend the life of a patient, but they're studied to see if they reduce specific cause, one cause, diagnosis. What they do is they do studies looking at, do less people in the treatment group die from this cancer than in the non-treatment group? You could actually kill more people, and this has happened with Herceptin, it's happened with several other drugs, it's happening with Provenge, the cancer vaccine, it's happening with ADT, androgen deprivation therapy, it's happening with radiation and chemotherapy for prostate cancer. They're killing more men with treatment. Thus, if the person dies of the side effects of the treatment, they can no longer die from the cancer. So therefore, cause-specific mortality is dropping. So there's less people diagnosed with prostate cancer or less people dying of prostate cancer because they died of heart attacks, strokes, and diabetes. I understand that this information I share may be quite upsetting. Why do I hammer the fraud and manipulation of the medical community right now? Because way too many doctors, way too many pharmacists, way too many pharmaceutical sales reps, way too many people in this world stand idly by and watch people become profit machines, money trees for an organization that doesn't care about their life, because they're willing to kill people for profits. They're willing to destroy people's lives. They're willing to destroy relationships that men could have with their wives by impotency, for money, for treatments that have no effect and do not extend the lives of these men. Why aren't more people standing up for this? And I love that Otis Webb Raleigh is, this doctor, this major medical physician. Again, I'm not the one saying it, but listen to this. The worst case scenario is at least equally compelling. Widespread use of hormonal agents is causing men to die of cardiovascular disease, diabetes, before they would ordinarily die of prostate cancer. That's what I expect or suspect is taking place. So this major medical physician, this chief scientific and medical officer, medical and scientific officer for the ACS says we're killing men faster, and that's what the research shows. All right, here's another one. This should disturb people. Dr. Brawley refers to individuals who promote screening of PSA, prostate-specific antigen, promoters of prostate cancer screening, as Lucifer. As I struggle to control my anger, the gentleman explains the business formula. What is taking place right now, he's describing an instance where an individual came to him to promote to him the use of those screening buses that go around the health department, sit in parking lots of different stores and places, and screen for prostate cancer or breast cancer. This guy's trying to, this salesman, this promoter of PSA screening is trying to get Dr. Brawley to endorse it and use it to make money for his hospital. Mind you, the funders of those buses for prostate cancer are the makers of Depends, he says in this book. Depends. Depends diapers. Why would Depends diapers specifically pay? Is it just the founder of Depends? Maybe. Maybe the founder of Depends is like, listen, I lost a father or grandfather to prostate cancer and he wants to save lives, maybe. And he's good-hearted. That could be. But the reality is, what Brawley says is they promote it because so many men will need diapers after going through prostate cancer treatments that Depends Diapers makes a huge profit off of this. As I struggle to control my anger, See, I struggle many times to control my anger when I watch what's going on. I hope somebody else does too, because this is ridiculous that we even allow this type of stuff to take place in a free country. Well, if you want to call it free. First, free screening provides free good publicity for the health system. People really feel good about us because this is a community service. It will cause women to come to our women's center. It will cause men to come to our chest pain center. Because androgen deprivation therapy and radiation and chemo causes heart problems. They didn't say that in the book, but that's what the research shows. It increases almost every product lines. It's cheap, effective advertising. For every 1,000 men over the age of 50 who volunteer for free screening, 145 will have the abnormal screen. Given the demography of the mall, 10 of the 145 will have insurance that our health system doesn't take. So 135 will come to see us for why they have the abnormal screen. My question is there. This man doing the free screenings is truly trying to save lives. He shouldn't be mentioning that, okay, so we're going to have about 10 people out of 145. They're not going to have insurance that our healthcare system takes, so then they're not going to come back. Why doesn't the person who wants to save a person's life say, we have got to go after those people, those 10, and save their life. We've got to help them. No, he just says they're not going to come in, they don't have insurance, so we're going to take the people with insurance and we're going to take advantage of them. We make up the cost of offering free screening by charging for the evaluation of the abnormal screens. About 40 to 45 will have cancer. We hit bingo with them. This is a direct quote by individuals promoting prostate cancer screening. Bingo. They hit bingo with cancer patients. Do you want to be referred to as a patient, an individual with cancer? Do you want to be referred to as hitting bingo? Major profits. We know the number who will get radical prostatectomy. We know the number who will get radiation therapy, the number who will get hormones. We know the number who will have incontinence so bad they will want an artificial urethral sphincter implanted. We even know the number who will not be able to get erections and will want Viagra. We know for how many Viagra won't work. We know how many penile prostheses we will then sell. Dr. Brawley ultimately says then, thinking to himself, realizing that I have been granted an audience with Lucifer, I ask the fundamental question, how many lives will you save if you screen 1,000 men? The marketer took his glasses off, looked at me as if I were a fool. Don't you know? No one knows if this stuff saves lives. I can't give you that number. Guys, if that doesn't piss you off, I don't know what does. This prostate, this Lucifer, this hand of the devil, this promoter of prostate cancer screening, knows the number who won't be able to have sex with their wives anymore, the number who will need Depends diapers, the number of penile prostheses they'll sell, artificial urethral sphincters implanted because they can't hold their bladder. They know the number for all the side effects and the profit they will make, but they can't even give you a number for the number of men they will save. If they can't give you a number for the number of lives they will save, the number of men they will save and extend the lives of, then you better not be trusting those people. You better shove them out of the office. You better shove them into the street. You better destroy their financial capabilities to continue to promote this fiction that PSA saves lives. Unacceptable in my book. Are we still alive? Or did Big Pharma shut us down? Because I'm on a stall here on my computer. I'm not seeing anything go. U.S. Task Force end routine prostate cancer screening. In 2012, this article from Reuters says screening advocates warned that the recommendation will cost lives. That's what the advocates for screening, again, hands of Lucifer. But critics of PSA testing said thousands of men will be spared impotence and incontinence as a result of needless cancer screening and treatment. Needless treatment. Needless treatment. 1 in 6 men will be diagnosed with prostate cancer. Here's another quote from Dr. Brawley, an expert in this field. It says, prostate biopsies that detect cancer do so based on research from the 1840s. So folks, if you're getting a biopsy of your prostate, you're trusting research that has not been confirmed since 1840. The task force looked at 64 studies, the available evidence, biopsies alone, after which 1/3 of men will experience pain, fever, bleeding, infection, difficulty urinating, and problems requiring medical attention. They say that 120 out of 1,000 screened men, about 90% of men will opt for surgery, radiation, and hormone deprivation therapy, ADT. Up to 5 men in 1,000 opting for surgery will die within a month, indicating those men were killed by the treatments. And again, they can't indicate that they save a single life. 10 to 70 more will have serious cardiovascular complications such as stroke and heart attack. Folks, these are the statistics on the use of PSA screening and then following the standard medical protocol. After radiation or surgery, 200 to 300 of the 1,000 men will suffer incontinence, won't be able to hold the bladders, impotence, won't be able to have sex with their wives again, or both. Hormone deprivation therapy causes erectile dysfunction in 400 of 1,000 men. And when you look at this, folks, get this. When you look at the research, if you use hormone deprivation therapy, which lowers your testosterone, gives men or you use any of these therapies that lower your ability to even have sex with your wives, what does having sex, let's be straightforward, ejaculate, what does it do? It increases PSA. So having sex helps prevent cancer. There you go, gentlemen. Go tell your wives you want to prevent cancer tonight. Have some fun. Because high PSA, or prostate-specific antigen, anti-angiogenic activity of prostate-specific antigen, coming to you from the Journal of the National Cancer Institute from 1999, PSA is not prostate-specific, having been detected in breast, lung, uterine cancers. In one study, patients whose breast tumors, women with high PSA levels or increased PSA levels, prostate-specific antigen levels, tumors had higher levels of PSA, had a better prognosis, which means they would live longer, than patients whose tumors had lower PSA levels. Get that, folks. Anti-angiogenesis, what is angiogenesis? Angiogenesis is the generation of blood vessels to areas of the body where tumors are forming. So the process, by being anti-angiogenic, slows down the process of blood vessel formation to tumors. Okay, a tumor cannot rapidly develop, can't grow out of control if your body does not supply it with adequate amount of blood supply. See, normal tissue throughout our body, isolated spots are not going to have enough blood flow for cancerous tumors to grow out of control and harm the person. So if you can eat things like cooked tomatoes are anti-angiogenic. There's many fruits and vegetables that are anti-angiogenic. They help promote, when you cut yourself, the reformation of blood vessels, but they allow for the proper genetic expression of angiogenesis. Unlike in cancer, when the body promotes too much blood vessel formation to that area of the body where the tumor is starting to form, it can't get bigger than like a ballpoint pen. It's really small. It can't grow any bigger than that until the body forms blood vessels. This is why things like thermography for breast cancer are so effective at finding cancer before even a mammogram or any other test can, because they can tell when blood vessels are forming, bringing in increased temperature and heat to that area of the body, thus indicating that a tumor will soon start to develop. So now we could start nutritional therapies way before any surgery could even be done, because there's no tumor there. We're just seeing the beginning stages of angiogenesis, or the formation of blood vessels. See, there's so many things. Again, why was I so excited that Trump was going to decrease the National Institute of Health's budget for cancer research because we're not applying the evidence we have in our hands. We're allowing thieves to work within our medical community to steal the lives, quality of life, relationship benefits from men and women. Steal our money. Bankruptcy. It's the number one cause of bankruptcies, medical expenses. It's the number one cause of foreclosures in homes. So it makes up about 80% of bankruptcies in America are caused from medical expenses. And then it makes up the number one cause of death. Folks, the medical system right now in America, because it's so broken, not broken in who's going to pay for it, broken in the sense that it's not focused on health, not focused on healing. And I'm going to give you that stuff. It'll either be at the end of this show or it'll be the next show, and we'll talk about the research and evidence about how you can literally treat breast or treat cancer, especially prostate cancer by the research at home on your own than the use of any medical physician, unless they really know how to dial into the research that shows you that lifestyle factors change your genetic expression. We're going to talk about that. All right. ACS's Brawley agrees that a fully informed man who wants to be screened in his doctor's office should be screened. A fully informed. He specifically says a fully informed man. See, the blood test is relatively harmless. The power of saying you have high PSA and the thought that high PSA means I've got to do something now to lower it. We are stuck on treating blood markers that are indicators of the body fighting something off. Cholesterol is the body trying to heal damaged tissue. Lowering cholesterol drugs cause people to die sooner. Lowering PSA, drugs to lower PSA cause men to die sooner. Folks, they're treating the body's natural. Treating a fever causes more people to die of infection. How many more things does the medical community have to mess up on and help people speed their death before the American people wake up and say enough's enough? Let's do something about it. Let's fire those medical physicians. If a doctor doesn't sit down with you and show you the nutritional research of how certain fruits or vegetables significantly lower the rate of prostate cancer development and progression, or even stop or halt the progression of cancer cells, then you better walk out of his office. Tell him, when you get abreast to the research, I might come back. But until then, I'm going to go see the wild doc. I'm going to give him a call. Or I'm just going to find the research on my own, read the study protocol, and then apply it to my life. Folks, we have so much information at our fingertips right now online. But sadly, we have this blind faith, and that's what they talk about. Patients have faith in their doctors, and doctors have faith in drug companies. And drug companies are Lucifer. So ultimately, we have a lot of people having faith in the devil. So a fully informed man, why should a fully informed man have access to a screening? Because we live in a free country. If somebody wants to do that, they should. And it's relatively harmless. And by indicating, if you have high cholesterol, if you have high prostate-specific antigen, okay, you can use those blood markers to say, okay, there's a possibility. Now, if you had sex the last night, or you ejaculated, guess what? You're going to have, or that they did a rectal exam first, yeah, or a colonoscopy, or ultrasound through your rectum, guess what? You're going to have high PSA because they stimulated the prostate. It's milking the prostate. If they do that, you're going to have high PSA. So if your doctor checked your blood after doing the rectal exam, guess what? You got a false positive. That happens a lot. So then men go back for biopsies, are harmed by the biopsies, because their doctor didn't go through the proper protocol not to do a rectal exam before you take the blood, because the rectal exam raises PSA. Then, you got high PSA, you might have cancer. Now we have to go back and do more testing. That's a brilliant medical doctor, because they're making a lot more money on you, because they caused what necessitated the biopsy. Yeah. Only if physicians are prepared. Only if physicians. This is what's sad, is physicians aren't prepared. Because the majority of medical physicians, I have handed this information in my lap to patients or patients' family members, or patients have handed it to their family members, and they go and ask their doctor, and their doctor hadn't even heard about this research. That, yeah, a chiropractor, a crazy wild man, reads. Only physicians are prepared to explain all this, including the PSA screening misses just as many cancer as it finds. That's nice. All right, folks. Tiffany chimes in. People depend on these tests. They scare people into this treatment. Exactly. Tiffany, you're right on. See, patients depend on the test. Doctors use it to scare them into treatments because they are afraid. And then they don't say, listen, prostate's a very, 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 very slow-growing cancer in like 90-some% of the men, okay? You can sit down and say, we don't need to do anything radical. We have research in our hands. On the floor, actually, there, I'm sorry. Where's it at? Where's it? Where's it? There it is. Listen to this. Healthy lifestyle triggers genetic changes. Comprehensive lifestyle changes, including better diet, more exercise, lead to not only a better physique, but also swift and dramatic changes at the genetic level, folks. So again, this is where it skews the genetic testing we use oftentimes. For many different conditions that are lifestyle-induced that change genetic expression, and then we say, oh, see, this gene is doing this, so that's why you have the cancer, but yet it's not the gene that causes it, it's the expression of the gene, which is dictated by epigenetics, things above your gene, such as your stress response in your nervous system, which can be thrown out of balance through research that shows that when your spine's out of alignment, causes a sympathetic tone, which alters gene expression. The activity of disease-preventing genes increase, while a number of disease-promoting genes, including those involved in prostate and breast cancer, will be shut down, according to the study published in the Journal of Proceedings of the National Academy of Sciences. It's an exciting finding because so often people say, oh, it's all in my genes. What can I do? Well, it turns out you're able to do a lot. In just 3 months, I can change hundreds of my genes simply by changing what I eat and how I live. That's pretty exciting, Ornish says. The implications of this study are not limited to men with prostate cancer. The men avoided conventional medical treatments from prostate cancer, and I have the research studies to prove that. See, this is phenomenal, folks, phenomenal. What you eat, what goes into your body can change your genes. You can shut, it was over 450-some genes that resist the development of cancer in the body were turned on. Around 50 genes that promote cancer were turned off. If they had a drug, a drug that could change a single gene or 2 genes, the person would probably win the Nobel Prize. Do we get that? This guy, these people, these researchers should win the Nobel Prize. But we're not effectively implementing this stuff into our medical treatment. And that's why I get so frustrated, because there are men right now who are going to be affected for their entire lives negatively by improper treatment that's being used, because you can't go back and say, like this drug, okay, this vaccine right here. This vaccine that costs $93,000, folks. $93,000, and I can't find it. I'll find it some point in time. It was Provenge is a vaccine for prostate cancer. My notes are all a mess. Anna says, your genes are like jeans. Pick your size. Skinny? Baggy? Rolled cuff? Yes, I'm barefoot right now. Same as gallbladder removal. Gallbladder removal is, yes, Anna, you're right on here. Gallbladder removal, things like that. You can change how your body's functioning, how it's healing. And I've got some great research on gallbladder removal, how they found in the 1800s that women and men, people who were having their gallbladders or even their ovaries removed, should have had their spines evaluated, and in curvatures, scoliosis, they should have had spinal correction, and then they would have been able to save their gallbladders, their ovaries, things like that. No education on surgery. They just cut people open. They are now aren't even putting people on the medications anymore to aid in waste release. People depend on these tests. Again, Tiffany saying that. Roderick Lamar. Lamar says, great info. Appreciate that, Lamar. Tiffany, you're right on with the cash. It's just sad that we have a system that's all about the money. It's all about the money. Thank you, Melissa. Jamie chimes in. For those who may be wondering, Dr. Dale, do you recommend any screenings? So here's the thing is like, okay, like thermography would be a phenomenal screening, okay? Heart rate variability is a phenomenal screening. I believe heart rate variability, evaluations of your spine are the most important. Get this, there are studies that indicate that individuals with scoliosis, now again, I've had other talks on this and I'll greater detail in the near future, but here's the reality. People with scoliosis, which is a severe misalignment of the spine, have significantly elevated mortality from all-cause mortality. Men who shrink 3 centimeters or more from forward head posture spinal decay, Archives of Internal Medicine from 2006 indicated that men have an increase of 64% greater mortality from all causes and a doubling of the heart disease risk because of spinal deterioration where they lose height indicates that the spine is deteriorating. When the spine deteriorates, it's going to put pressure and stress on the nervous system. When the spinal cord or the nerves have pressure on them or stress or tension or the spine doesn't move properly, it negatively impacts the function of the nervous system, homeostasis. It increases sympathetic tone. Through that process, what it does is it downregulates the body's ability to adapt. So heart rate variability testing can test how well your body's adapting to stressors. How resilient is your body? That testing can literally show you an indication of how well your body's able to fight off diseases of any type. The nervous system is key, folks. Look at this, the association between autonomic dysfunction. So that would be, again, poor heart rate variability studies is what they used in this. Autonomic nervous system dysfunction is a common syndrome in patients with advanced cancers associated with a decreased survival of several patient populations, including diabetes, heart failure, neurological diseases. Based on the evidence, we hypothesize that autonomic dysfunction is associated with decreased survival in patients with advanced cancer. And that's what they indicate. Conclusions, autonomic dysfunction is associated with a shorter survival in male patients with advanced cancer, specifically prostate cancer. Reduced heart rate variability has been associated with ventricular arrhythmias, silent myocardial infarction, and sudden unexplained death. So when somebody dies and we don't understand why, doctors they'll do autopsies, can't figure it out, we don't know, they can't explain it. The nervous system shut down. See, that's the test I see, because it gives you, and again, you're not going to take a drug to change, you're going to do things in your life to remove burden and stress on your nervous system so that your body can adapt. You remove a stress. So if you correct the spine, that's not just the way, but there's multiple ways, and you have to identify those factors that are putting a burden or stress on your body, whether it be a spinal misalignment, poor nutrition, a poor relationship, a relationship that needs mending, a job that's way too stressful for you, something in your life is creating stress, reducing. It's like put a rucksack on a soldier, all right? Send them into battle. If they've got that stress, you know what? Tear that rucksack off so they can fight at 100%. Right then and there. See, it's a burden on their shoulders already. That's what poor heart rate variability indicates, a burden on the shoulders of the individual. So if you got to run from a tiger, get that rucksack off your back. You follow me? And run like the wind. We have to identify what are the burdens on this person that are allowing them to be attacked by that tiger and mauled. They've got to get away. We got to cage that tiger. We got to remove the rucksack. We got to remove that burden. And that's what spinal correction can do for people. Again, I'm a chiropractor. I'm promoting. I'm blowing my own whistle. In the general population, reduced heart rate variability is also found to be a predictor for cardiovascular risk factors, including increased mortality. So phenomenal research. Again, in prostate cancer patients, if the poor heart rate variability, and we do these tests in my office, I'm promoting myself, yes. Shameless plug. But the reality is you can go get your PSA checked, which can indicate your body's actually fighting cancer. You can then get scared into doing the wrong treatments, not be given the nutritional evidence that we can give you in my office. See, the reality is what I tell people is, you know, one of my patients actually was charged $11,000 for x-rays and then prescribed medications after a car accident at the hospital. $11,000. Got drugs, she didn't want drugs. But that's all, literally. So guess what? I charge $150 for x-rays in my office in the initial consult, paperwork, those things. Is that a lot of money? Is that a lot of money? Seriously. It may be a lot of money, like 150 is not a little bit of money for many people, But the reality is, look at the comparison of what they're doing. The highway robbery by the hospital out here. Because they got to pay all their investors and board members and all the people that make money that only actually serve people. Why don't we start a healthcare system where it's I serve you, I help you. Whoever the medical, I help you individually, and you pay me. I don't pay all these investors, all these people that aren't doing, like, it's ridiculous. We live in a free country, we can do what we want. I guess that's true. But the reality is, then you got to upcharge the person who is suffering, sick and suffering, and needs help and assistance. They're not a money tree. We make care affordable. We give people the tools to empower themselves. That also changes. There's only so much time a person has with each individual. We've got to figure out a way to implement a healthcare system effectively. All right. I love all the shares. I love all the truths. I love all this stuff. For those who have been told it must have screenings, what would you say? Talk about preventatives. See, screenings in many senses, as long as like mammograms, and we'll have a section, it'll probably be, now April is, I believe it should be called not Autism Awareness Month, it should be called CDC Whistleblower Awareness Month and Vaccine Injury Awareness Month. That's what it should be called. Yeah. We'll talk about, we're going to have an episode the last week of April. We'll be talking specifically about autism, vaccine injury, the CDC. We're going to just hammer that information because it's high time. It's been 2 years since we've had a confession by a CDC scientist saying, hey, us here at the government, the government taxpayer-funded organization that's supposed to be looking out for the taxpayers, hey, I want to confess we've been lying to people. We actually are trying to hide the fact that autism is caused by vaccines. A confession, folks. A confession. This is the kind of stuff. Why does our country stand for this? I will not stand for this. Will you stand for it? I will sit down for it. Don't sit down for it either. Get off your rear ends and do something about it. Tell your neighbors. Tell your friends. Share this video. Tell people about the Wild Doc site. And make sure you educate them on that I'm a little wild. I mean, I feel like I need something for my blood pressure. This makes my blood boil, Melissa says. This just makes me furious, Jamie. Jamie says also the Big Brother hasn't shut you down yet. Keep fighting the good fight. Our daddy is bigger than Big Brother. Our Father is, yes. All right. 6:42, we got about 20 minutes left in the show program. Again, people watching on TV, you can chime in on Facebook every Tuesday evening, or as many Tuesday evenings as I possibly can manage. 1 hour shows, you can chime in, ask your questions. You can email me questions. You can go to thewilddoc.com, get the evidence information that I'm sharing with you, because again, it's not my opinion. You can know my opinion, obviously, but you're getting the facts and research. I love just talking, speaking from the evidence and research, because the reality is, I've got to protect my license. We got a free country, thank God, where freedom of speech and leading off research is allowed. Angiogenesis, we talked about the PSA is inhibiting endothelial proliferation, migration, invasion of cancer cells. Phenomenal research that PSA helps us. Hormone drugs for prostate cancer may hurt your heart. I want to make this very clear. So here's what we need to do. Anthony, you're going to assist me with this. Make sure the screen can see us both. Come on over here. We'll be able to see it right here. All right. So Anthony, my camera guy, this is this guy right here. All right, he's going to come in here. He is my patient. I'm doctor. All right, sir. All right, here we go. All right, so sorry, Anthony, but I have to give you this. It's a diagnosis of prostate cancer. Okay? You had high PSA on your test. You have prostate cancer. Immediately, what are most people going to think? What are you going to think? I mean, if you got that test now today, I mean, you would think, oh my, well, hopefully you'd be like, oh, something's wrong, I'm scared, I'm worried. Hopefully you wouldn't be, Anthony, because you've been working with me so long. You'd be like, hey, doc, what's that nutritional regimen I should be on that I probably aren't all the time? You know, I tell people, I got a best friend ask me, Doc, Dale, what would you do? What would you do? My buddy Nick, he asked me, what would you do if you got cancer? And I just told him I would basically take what I'm doing now, living a healthy lifestyle to prevent cancer, heart disease, those things. I would just take that and do it at 110%. I wouldn't have a vacation meal. You know, that's what I would do. But here's what the system does. They take a person, they say, here's what you have. There you go, you got that. But what I'm gonna do is I'm gonna prescribe to you, okay, I'm gonna write a prescription here. They write out their prescription for the radiation, their chemo, and their drugs, and they actually hand the person this. Folks, literally this is what they do. Prostate cancer treatments. Thanks, Anthony. They kill men with heart disease and diabetes. Number 1 and number 2 killers of men. Prostate cancer is further down the line. They give them the number 1 and number 2 killers, and they don't mention that, well, they don't actually give them the number 1. Number 1 would be medical treatment, which now take the statistics of heart disease and diabetes, which many men who are getting androgen deprivation therapy, radiation, and chemotherapy that will cause them to have heart problems or cause them to have diabetes. So they get a diagnosis of heart disease and stroke, and they die of those things. So on the statistics for the medical system, they get to say, hey, this person died of a stroke, a heart, cardiovascular disease, and then they indicate further down the paperwork that it was caused by their medical treatment, but they don't actually put a statistic that it was caused doctor-induced iatrogenic disease. Again, I've said this before. To put this in perspective, what I just would have done, if that was a real-life scenario, I would have taken a person, done a test that right now isn't even recommended, has no validity by the research. The person who found it, the founder of the study, says a public health disaster has occurred. A profit-driven public health disaster has occurred because of that. I would have basically said, I might as well have handed him a 9mm and said, we're going to reduce your risk of dying from prostate cancer. Here's a 9mm. Take it. Take 1 dose tonight. He won't die of prostate cancer. So statistically, see, that's how they're utilizing statistics for which they are harming people, but using the harm of that. Yeah. Did I explain that properly? Please give me a thumbs up because I want to hammer that home. The statistics are skewed because if you kill a man from something else, they don't get the opportunity to live long enough to die from their cancer. Therefore, your statistics look great the more men you treat. Again, hormone drugs for prostate cancer hurt the heart, they're causing cholesterol to go up, worsening blood sugar, fattier liver, thus raising the risk of heart attack and stroke. Screening does more harm than good. I had some highlights. I want to read some of these things. Another one. This comes from Forbes magazine. The harms of screening have demonstrated consistently that screening does more harm. PSA screening, lives saved, and hormonal monotherapy. It's time to face the quietly ignored facts beyond the abstract. Folks, this is... So there's 2 research studies that they utilize and they continue to use for saying that PSA testing actually saves lives. But get this, folks. Get this. Where is it? That vital evidence that could help in regard to this decision of whether we should continue PSA screening is quarantined. Huh? Wait, what? Quarantined. That's exactly what they quarantined. The pushback to avoid independent and timely evaluation of the ERSPC and GOTEBORG data, or to seriously consider any explanation of them outside of PSA screening saves lives, that's all they say, flies in the face of normally accepted scientific protocol. Data from Gothenburg, that's the way you pronounce it, I guess. It's abbreviation letters. Randomized trial are not available to outside investigators. A similar restriction is also on the ERSPC data, has come from their researchers. So the 2 studies touted as evidence for why we should continue using PSA screening, the data is quarantined. You can't see it, I can't see it. Freedom of Information Act could acquire it, would take years, but guess what? Outside medical researchers are not allowed to look at it. Why not? Like, this is what's so ridiculous about science right now. You have to hide your data. You won't. So it's like, it saves lives. Okay. Oh, really? That's awesome. Can I see the evidence? No. No, you're not allowed to see the evidence. Why not? Because it saves lives, and I don't want to show you. I don't want to show you my data. It's mine. It's mine. It's all mine. I'm running with all of it. I mean, just like, seriously, like, why? Evil hides in the darkness. Good comes out to light. Guys, do we get this? You guys get, like, how much more common, please give, Lord bless doctors with common sense to know that if somebody has to conceal the data, then the evidence probably points towards harms, that it's not what they say, that they're lying to us. The data is still to be publicly released. PSA levels plummet after, and this is important, PSA levels plummet after androgen deprivation therapy or monotherapy and can remain low for years, providing enormous comfort to the patient. And this is another way for which a doctor could lead to the early death of somebody, because if we give a person comfort in one thing, a false sense of security that their PSA has gone down, they think they've reduced their risk of cancer and dying early, so then they don't do the other things that they need to do to extend their life. That's another way of harm, not just the side effects, but the false sense of security. It is nevertheless appearing that becoming more widespread outside the FDA guidelines. The use of this therapy is more widespread outside of the FDA guidelines. Prostate cancer screening biases. Coming to you from the Oxford Journals, Oxford Press. Widespread screening was adopted quickly in the United States, where it is dogma, like a religion, that early detection and aggressive treatment saves lives. Yet, the prostate, lung, colon, and ovarian cancer screening trial, which suggested that screening does not reduce mortality. So screening for prostate, screening for lung, screening for colon, screening for ovarian cancer does not extend lives. Because of the bias towards newer therapies, there was early widespread uptake in Europe and the United States without full assessment of its benefits and risks. So we use treatments without the full understanding of benefits or risks, and come to find out that the androgen therapy is inappropriate. If ADT does increase risk of cardiovascular and thrombotic or stroke risks, it is amazing treatment bias in these screening studies. Amazing treatment bias, again, going back to when you kill somebody from something else, they're not going to die of prostate cancer anymore, so then their statistics of specific cause mortality is improved. Thus, when you only indicate specific, diagnose, cause-specific mortality, you make yourself look good by killing people. United States, Europe. Early deaths due to ADT-induced cardiovascular and stroke would prevent later deaths actually caused by prostate cancer. Several retrospective studies suggest increased death from cardiovascular disease. That is, 6 studies they indicate. Some studies show increased risk of stroke events, as does one prospective cohort study. Increased risk of death from cardiovascular disease is not seen in major prospective randomized trials using short-term hormonal therapy with radiation. With access to all data is what we need. Most respected professional organizations have appropriately warned against mass screening. And this is the thing, is we still see massive use of PSA screening. I'm hung up there, Anthony. Most respected professional organizations have appropriately warned against mass screening. That's great, but the word hasn't gotten out. They literally stated on their website, but nobody reads in depth and searches for that answer, searches for the facts. They go to their doctors. The doctor says, get the screening. They see the bus at Walmart's parking lot or the health department's parking lot who allow the Lucifer, the devil, to sit there and screen people. Most respected professionals. Hey, that's me. I guess I'm a respected professional now. I mean, the way I act, I'm sure a lot of people are like, how can you even respect this guy? He's kind of nuts. I just like to have fun with life. That's all there is to it. It's way too short, and it'll be shortened if you do prostate cancer treatments conventionally. Prostate cancer overdiagnosis. So this is another one. This is what's sad. Because men have not gotten this type of information, it broken down, given to them hardcore, 100%, here's the truth, no smoke and mirrors here. You got to understand, you can do the test, but the test drives you over here into doing things that are harmful. So if you don't have a plan to do what is right for your body with the results from that test, then ultimately it can be a harm. Don't do the test unless you already know what treatments are going to be effective for that. Many men plan to ignore, and again, the next show we'll talk specifically about effectively the research on effective treatments against prostate cancer. Many men plan to ignore PSA test guidelines. So after the U.S. Preventive Service Task Force came out with the data and information saying, listen, we've looked at all the studies. It's 100% fact. We're harming more men. We're killing more men. We're not saving lives. We need to stop it. You can still get it because it's a free country. The test itself is not harmful, but what it drives you to is massive evidence shows nutritional therapies, amazing wellness herbs, nutrients, mushrooms, hemp. Yeah, just great, amazing stuff. Effective at killing cancer cells, reversing cancers, changing genetic expression, enhancing quality of life. So you can choose, on one hand, impotency, wearing diapers, or over here, you can choose eating fruits and vegetables, actually having more stamina, lasting longer, both in life and in the bedroom. Which one do you want? Find out next time on The Wild Doc. Hey everybody, I'm The Wild Doc, and if you enjoyed this video, make sure that you hop on over to thewilddoc.com. Subscribe there for our newsletter and email campaign. Join in the conversation on Facebook, and let's transform the world by unleashing the power of natural healing.